Hey guys, this video is going to be used to complement the PowerPoint that we have for the Sfma Top Tier. So in this video we'll go through cervical extension, cervical rotation, cervical flexion, and then upper extremity patterns 1 and 2. So my lovely assistant Laura, my wife here, is going to help us out. The first thing that she's going to do is face me. So as she faces me, I'm going to ask her to please touch your chin to your chest. So this is cervical flexion. Our goal here is, can my patient touch her chin to her chest? And she can't, so that functional criteria is not met. We also then need to see, does she have a uniform spinal curve? And she does. And if you see here at the CT junction, we have a hinging and a flattening of the cervical spine that exists here. We'll then have my patient look straight up again here, neutral, and then we'll look up. So we'll extend backwards. Now my goal here is, can my patient's nose-chin line get within 10 degrees of parallel to the floor or ceiling? And so what I'm looking for here is 90, here is completely parallel, so I need to be 10 degrees off of that. And she does, she hits that mark. And then does she have a uniform spinal curve? So we can take a look at the spinal curve that exists here. She does have a uniform spinal curve. If she has no pain, this is a functional test for her. So we'll have her face the camera here. Now we're going to do rotation. So when we do rotation, we want to use that nose-chin line. And does it go over that mid-clavicular line? So as she rotates over, does that nose-chin line meet that mid-clavicular line? So I'm going to have her rotate over here towards me, and I'm looking to see, does this nose-chin line cross over that mid-clavicular line? And it does not for her. We also need to make sure that she's not compensating. And one area of compensation that a patient can do is this extension or this lateral flexion, as they try to couple those two motions, that extension and rotation. Those motions kind of couple each other. The next thing we're going to do then is our upper extremity pattern. So for the upper extremity pattern 1, we're going to have our patient reach back behind their back and touch the inferior angle of the opposite scapula. And so as she reaches back here, she can touch that mark. Now the functional criteria for her here is, can she do this motion? Is it pain-free? And does it have any excessive effort with it? And so if it had excessive effort, it would look like her hitting here and then moving up to hit that mark. We can also have radial deviation. So if she's here and she moves that wrist up to try to get her fingers to touch that mark, we've got this little bit of a radial deviation that exists here with her hand and wrist. The upper extremity pattern 2 then is where we're going to describe to our patient, it's like you're slicking your hair back and touching the opposite shoulder. So she reaches back and touches that opposite shoulder. We're looking, does she touch the spine of the scapula? And she does. And then does she have anterior head carriage, or is she moving her head forward to touch that motion? And if she does, then that is a departure from a functional movement, and we would say that that is dysfunctional in nature. She's able to get this motion without moving her head, and so this is a functional movement for her. All right, so in this video we're going to go through the remainder of the top tier motion. So we have multi-segmental flexion, multi-segmental extension, multi-segmental rotation, single leg stance, and then an arms down deep squat. So the first motion that we're going to do is a multi-segmental flexion. My patient will face away from me here, and then I'm going to ask my patient to stick their hands out here. I want them to look at their fingers and then follow their fingers to just the tips of their toes. And what I need to observe when my patient is going through here is, 1, does she touch her toes? And she does. So now I need to look at some other functional criteria. Do I have a sacral angle of at least 70 degrees? And I do here. So this is 90 here, 80, 70, and I think that she gets beyond 70, which is good. That's what we want. I also need a posterior weight shift, so we should have the pelvis shift backwards as she comes down to touch her toes. I need a uniform spinal curve throughout that thoracolumbar junction, and then I need no excessive effort and no pain to call this a functional movement. So this is a functional movement for her. We do multi-segmental extension next. So again, I'm going to have my patient face away from me. I'm going to have her flex her shoulders all the way up here. So I need 170 degrees of shoulder flexion. She's going to look at her hands, and then she's going to extend backwards. I want the spine of the scapula to fall behind the heels. I need the ASIS to go in front of the toes, and then I need my patient to maintain 170 degrees of shoulder flexion without losing any composure through the core, without having that excessive effort or pain that exists here, and she is able to do that. Next is multi-segmental rotation, and this one is one that's we will use a landmark for. So as my patient turns around to face away from me, I'm going to ask my patient to rotate around, and I'm going to stand in a position where I'm wanting them to rotate too. So she's going to rotate around here, and I want her to look back here towards me when I have her rotate. So I'm going to describe to my patient, I want you to keep your feet together, your arms at your side. I want you to rotate over your right shoulder, rotate over here towards me. Try to find my hand. And what I should be able to do is I should be able to see this opposite shoulder as she rotates. And so if I'm able to see that opposite shoulder, then I'm getting 100 degrees of rotation, which I need for this to be a functional movement. I need 50 degrees from the pelvis, and I need 50 degrees from the torso. And so an easy way to do that is I should be able to see that opposite shoulder. So in this instance, we are dysfunctional, unfortunately. So we'll have to face our lovely crowd here one more time. That leaves us with two more. We have a single leg stance. So the single leg stance, we simply ask our patient to stand on one leg, and we're going to make this uniform by just having them bend their knee like this, and they'll stand. We're going to count till 10 with their eyes open. So we'll say that's 8, 9, 10. Great, bring your leg back down. Now we're going to take vision out. If you remember, the very first day of lecture, I said that we had 3 systems that were extremely important, and they're going to be something that I'm going to talk about for the entire trimester: the visual system, vestibular cochlear system, and the somatosensory system. And here they are again. We're testing them again. And so as my patient is standing on one leg, I'm going to have her close her eyes, and we'll count to 10 again. Now she gets 50% more motion. Go ahead and put your foot back down. So she gets 50% more motion with that, but I don't want to see my patient start airplaning or losing height. Anything that my patient does to lose height, whether that be bowing forward, extending backwards, or going back and forth, that will be a dysfunctional movement. The last top tier motion that we're going to do is a arms down deep squat. So as my patient faces away from me here, I'm going to have her start with her arms straight out in front of her, and then I'll have her squat down with her feet together. I want her to squat down so her thighs go below parallel. And then after her thighs go below parallel, I want her to bring her arms down within her own footprint, so on either side of her foot, and then bring them straight back out in front and stand straight back up. So I'll have her arms come down. I'm going to squat. I'm going to spot because I have a feeling I know what's going to happen. Good, come back up. Good. So we didn't quite get there on this one, but this is one we've done in lab a couple of times, so you guys have all had exposure to this motion. That is the top tier. Use these 2 videos to help you when going through that PowerPoint, so that you can hopefully visually see it and then read through it as well.